Welcome everyone, to all the attendees out there in the cyber world. Thanks for joining us on this experiment as we try to figure out a variety of ways to get evidence, get information out there, whether it be through policy briefs, through blog posts, and now through webinars. So welcome to the St. Louis University School of Education PRiME Center, or Policy Research in Missouri Education Center. We are an education research group committed to supporting education leaders across Missouri. You might know that our motto is better evidence, better policies, better schools. That's our goal, to get as much evidence out there as we can into education conversations. We realize that not every question is one where evidence will make a huge difference. And lots of questions are argued about and debated for political reasons. But so many questions require evidence, and our leaders are grappling with tough decisions. And we in a university are in the very privileged position of being able to study things for a living. So it's our job, we think, to create evidence as best as possible and communicate it to folks. As I said, this is our first attempt in a new communication strategy, the PRiME webinar series. These webinars will be held monthly. Our next webinar will be January 27th, and we'll focus on a topic that I've spent a lot of time researching, discipline disparities in this state and around the country. Please register on the PRiME website or follow us on Twitter to get more details. And if you're not following us on Twitter, please do. Today's topic is going to focus on school nutrition, and our speakers are going to dive into several aspects of what food does for our kids. A very straightforward title to a very straightforward question, really, but there are lots of ways to think about it. And we're thrilled to have a panel of speakers today, all connected to St. Louis University in a few different areas. We're going to start with Andrew Deemer, who's a graduate student here in the PRiME Research Center. He's a PhD student in education and education policy and equity here at the university. Evan will be followed up by Dr. Ellen Barnage. Ellen is a PRiME affiliated researcher, and she's associate professor in behavioral science and health education in our neighboring College of Public Health and Social Justice here at St. Louis University. And we're thrilled that Ellen's involved with PRiME's work, and we're excited to hear her conversation today. And finally, we're going to wrap up with Amy Shelton, who's another graduate assistant here in the PRiME Center. And she is also pursuing a PhD in education policy and equity here in our School of Education. Each speaker is going to present for 10 minutes. We're going to keep it tight there, so there's more than enough time for questions and Q&A at the end. Please submit questions in the Q&A box throughout the presentations. And at this point, Emily, I'll pass it back to you.
Great, and I will pass it right to Andrew. Andrew, are you able to share your screen, or would you like me to?
I'm happy to do so.
Thank you.
Go ahead. Can you see my screen? Cool, okay. Thank you. Thank you, Dr. Ritter. So I'll be talking about how food impacts the household, and to do so, I want to talk about a few things. The first of which is food assistance programs, how they make a significant contribution to low-income family food budgets, how COVID-19 reduced food access and strained some food budgets, food insecurity, how it increases health risks and also decreases student achievement, and how we maybe as policymakers and as community can help. So the first program I want to talk about is the National School Lunch Program. The National School Lunch Program provides meals to low-income students through their schools. These meals are known as FRL meals. We might know them or be familiar with them as free and reduced price lunch meals. But FRL and the National School Lunch Program, students receive a lot more than just lunch through their schools. They receive snacks, fruits and vegetables, breakfast. And in fact, 50% of Missouri students receive FRL meals, which is similar to the student body. Nationally, the student body also, 50% of students also receive free and reduced price lunch meals through their schools. In Missouri, that pans out to about 435,000 students. On the right, I've included, just to put a little context here, like what sort of how many meals that looks like per month. So in general, it's about 6 million meals per month, which is a lot of meals. I've highlighted in orange here the months of April, May, and June, which this year, or this past school year, schools were shut down for. I've highlighted these just to sort of bring into context what students have relied on in the past. We see in April that it's one of the months of highest or the highest dependency on meals by students, at least in the past 2 school years. And although the data isn't available on this yet, we imagine that the meals that were provided by schools and to students through Missouri was significantly lower this year, which is a problem. But all this is to say that we rely on our schools to feed students and across the nation, not just to educate them anymore, millions of meals per month handed out to students that need them to stay food secure. The other program that many students rely on, many families across Missouri rely on, is the Supplemental Nutrition Assistance Program, formerly known as food stamps, now known as SNAP. It provides benefits to families so that they can move towards self-sufficiency. 450,000 children receive SNAP benefits, similar to the amount of students that receive FRL benefits or free and reduced price lunch. And this number has decreased slightly over the past few years, but increased, as you might notice, following the Great Recession. That's because SNAP benefits were actually increased following the Great Recession to help families avoid cycles of poverty and avoid some of the impacts of the recession. That has not been done so thus far, but there's good evidence to suggest that increasing those SNAP benefits previously really led to allowing a lot of families to avoid cycles of poverty, to avoid becoming food insecure. The same could be done so now. And federal and state safety net programs like these combine to lift about 250,000 children out of poverty each year. This lowers the effective poverty rate from about 28% to about 10% in Missouri. So these programs are immensely impactful to Missouri families. They are they provide a huge benefit to families so that they are able to avoid poverty, so that they are able to remain food secure. And just maybe to put a little bit of context on some of the financial benefit that families might receive because of these programs, we could consider the USDA low-cost food plan, which is a food plan that's recommended to low-budget families, families working on a low budget, and it costs around $10,000 a year. This food plan would provide food so that families can stay healthy, can stay active through each month, and it comes out to about $10,000 a year. 19% of Missouri's school-age children live below the poverty line. In Missouri, for a family of 4, that's about $24,000 a year. And we can just sort of do some quick math to imagine that about nearly half of after-tax family income would need to be spent for a family to avoid the low-cost food plan. In October, to sort of imagine how SNAP and maybe FRL can contribute, or in the case of school closure, maybe strain family budgets. In October, the SNAP maximum benefit was $680 a month. At the beginning of school closure, it was slightly lower. So it's good that it's increased. But we could also see that the $680 doesn't quite make it all the way to the $850 a month that a family might need to be able to stay food secure, or at least have to maintain what the USD recommends to a low budget family. We can also see that during the months of school closure, families might have taken on an increased financial cost. FRL meals are estimated to cost about $30, or to benefit families to the tune of about $30 per student per week. So for a family of 4, that's about $240. And that's a lot for families already struggling to try to make ends meet and try to provide food for their families. That money is difficult to come by. That can prove to be a lot. It could even prove to push families over the edge into becoming food insecure. So let's talk about some of the impacts of COVID-19, what it might have done to schools. Schools closed April 9th. So for families across Missouri, that meant meals stopped coming on April 9th, that they had to all of a sudden front the bill for students or for their children that were otherwise receiving meals 2/3 of their daily nutrition, even through their schools. At the same time, unemployment began to skyrocket. This was especially true for some families of color across Missouri. And that means that families likely had to make difficult choices. For families whose students were at home and maybe even are still now, parents maybe are making the decision to stay at home to help teach their child, or go to work to be able to get the money necessary to be able to feed their child, to be able to feed their family. Um, as a response to school shutdown, some schools did try to distribute food. Some schools are still trying to do so now, but not all schools, not all districts have been able to do so, and not always. Case in point, Ferguson was delivering meals to students, but regrettably, after the death of 2 bus drivers who were delivering food from COVID-19 related illnesses, Ferguson stopped. So did other districts around Missouri as a response to that. In Kansas City, a food worker tested positive, and meals had to be stopped. Meal delivery had to be stopped for a few weeks. This is important because even short-term food insecurity can have long-term benefits. Though there was a one-time USDA benefit to all families across the nation, in Missouri there was $302. We might recall from the last slide that $240 is the estimated cost that a family might have taken on per month, and $302, while nice, may not have covered the total cost that families had to take on to feed their children during the length of shutdown or even continuing today. Moreover, as many as 40% of eligible families didn't receive any benefits at all. There are, though there were efforts by school districts, though there was efforts by the Department of Elementary and Secondary Education to enroll all families that are eligible, not all families were enrolled. And so these families just simply aren't receiving any benefits at all and probably took on the greatest financial hardship. There are many impacts of food insecurity, and I just want to highlight a few. Mainly, the impacts of food insecurity decrease academic achievement in children by compromising emotional well-being, by contributing to lower school engagement. There's a higher likelihood of repeating a grade, and even the timing of SNAP benefits of food arrival has been shown to benefit students in school. This is to say that, so in students that were receiving SNAP benefits, they typically do better about a week actually after getting the benefits, when families are able to spend the money that they've received for food. But also students tend to test lower when those SNAP benefits tend to wear out towards the end of that cycle. But of course, too, and perhaps even more importantly, there are household risks to becoming food insecure, an increased risk of poor physical and mental health outcomes, long-term risks of early hospitalization, developing chronic diseases, or even developing depression. It's also been shown that some families will deprive themselves of meals. Older people or older members of the family will deprive themselves of meals so that younger students can eat, younger children can eat. There are great impacts of food insecurity. So some quick takeaways, real quick, to go over some of the things that we've talked about very quickly. So food assistance programs make up a significant contribution to low-income family budgets. COVID-19 reduced access to food and strained food budgets, and food insecurity increases health risks in household and decreases student achievement. So what this all means, it means that families right now are at greater risk of becoming food insecure. By some estimates, 125,000 Missouri children will become food insecure as a result of COVID-19. That's not existing children, that's not a total number, that's new children that would become food insecure as a result of COVID-19 in Missouri alone. And so that means that DESE and Missouri must find a way to support alternative meal distribution. There have been some efforts, there were some efforts in southeastern Missouri, like the National Guard providing meals, but there could be other efforts that we could consider too. DESE could provide students, or could provide guidance and assistance to districts. So far, there has been little guidance and little advice that DESE has provided to districts of how to provide meals, or whether or not they even should. We might call on DESE to do something similar. And Missouri and DESE might find a way to ensure that all eligible families have information about meal assistance programs made available to them, so that no families, especially not 40% of families that are eligible, go without these benefits. With that, I suppose I can toss it over to Dr. Barnage.
All right, thank you, Andrew. I am going to just bring up my presentation and we'll get going. All right, so I am Ellen Barnage. I'm Associate Professor in the College for Public Health and Social Justice. So in addition to getting perspective from education scholars, you'll also get a little bit from the public health side of things. I am currently funded to examine food insecurity in clinical settings. So we are doing a project right now that looks at screening for food and other social needs at pediatric well child visits, and then connecting families who disclose food insecurity to community-based organizations that might be able to address those needs. So today I'm going to talk a little bit about the association between food insecurity and health among children. So as Andrew noted, food insecurity is a household level economic and social condition. It's not the same thing as hunger, which is an individual level physiological condition. Hunger may result from food insecurity, but what's important to note is that when we measure food insecurity in the United States, we're not only looking at the reduction of food consumed, but we're also measuring a worry around not having enough resources to meet the food needs in a household. So there's more than one part as we think about that. So in May 2020, there was a report by Feeding America, which is our food bank network here in the United States, that estimated that between 24 and 26% of Missouri children will be living in a food insecure household as a result of economic and health consequences of COVID-19. So that number includes not only those who will additionally likely be living in a food insecure household after COVID, but also those who are already living in that situation prior to COVID. So I tend to think about or visualize this in terms of a classroom where 5 out of 20 students might be living in a food insecure household. And because we know that food insecurity is not distributed evenly in a population, it's likely that in some schools, this might be closer to 9 or 10 students in a classroom living in a food insecure household. So in order for us to really understand the link between food insecurity and health, my colleague Hilary Seligman and her colleague Dr. Schillinger put together this conceptualization that I really think helps us understand what's going on. So individuals living in food insecure households are more likely to purchase high caloric, low nutrient dense foods that tend to be less expensive. At the same time, they're dealing with the stress of trying to meet basic needs in the household. Both of these, diet quality and stress, can lead to diet-related chronic disease for individuals in food insecure households. Chronic disease then can lower our functional status. So the things that we can do without chronic disease may become more difficult. At the same time, we also have increased health care costs. So you might be paying for medication, for example, and that dealing with chronic disease at the same time as dealing with food insecurity complicates the situations in many households. So that sometimes what happens is that people have to make very difficult trade-offs, particularly with older adults. We think about the trade-off between purchasing medication or purchasing food. As we think about children, though, over the last 15 years, there has been a demonstrated association between living in a food insecure household and adverse health outcomes. So a recent study in pediatrics identified or confirmed some of these early associations in previous literature. And what they found is when caregivers reported household food insecurity, they were also more likely to report that their child was in fair or poor health, that their child had visited the emergency department more often, that they had delayed medical and dental care for their children, that their children experienced asthma or other skin allergies, and also experienced depressive symptoms. So here again, making the link very clear between health and living in a food insecure household. A special population, though, among children, I think that's important, is looking at adolescents. So previously, I noted that it was caregiver self-report, both about household food insecurity, but also then about the health conditions of their children. What is important to note, though, is that oftentimes adolescents are having a different experience of food insecurity in the household than many adults recognize. So, for example, they may be coping with food insecurity in ways that is not apparent to the adult. So children younger than 10 typically tend to be protected in the household. So caregivers will make sure to feed younger children first, for example. But as children age, they take on more responsibility in the household, and they also become more aware of the household situation. They may be coping in ways that are not noticeable at first. So reducing the size of their meals or saying they're not hungry and things like that. At the same time, adolescence is a rapid period of growth. So Andrew talked about SNAP benefits. One of the things that does not change regardless of the age of the child is the allocation of SNAP benefits. So they calculate that based on the number of children in a household, not on the ages. And as we know, kids who are growing rapidly eat more often if they can. But the other thing that's happening at this time is that adolescents are managing, sometimes for the first time, food assistance programs and dealing with stigma related to help-seeking behaviors. So that's another important factor during this period of development. So as a result of these things, there's been increased interest in food insecurity among adolescents, particularly in the coping strategies that they employ. So an exploratory qualitative study conducted in Baltimore City asks young people to report on some of the risky health behaviors, or they asked about how young people cope, and the young people reported risky health behaviors, such as stealing food to meet their basic food needs. So as we begin to think then about how to address this, particularly with adolescents, we want to think about the framework of food insecurity generally. And these are the 4 A's, which were developed by the Food and Ag Organization of the United Nations to help us think about what does it mean to be in a household with food insecurity. So the first thing we want to think about for young people is the availability of food. So where can young people get food in the various settings in which they find themselves? In those places where there's food available, for example, at school, we also want to think about how can they access that food. So what are some of the barriers that might get in the way? For example, stigma that would prevent them from accessing the food that is available. Then we also want to consider adequacy. So can students get enough nutritious food for an active, healthy life? So this is more of the focus too on the nutritional aspects. And then the last is agency. So how are students able to play a role in determining what they eat, how they eat it, and how they acquire the food that they eat? So some of these questions really, I think, also pop up in Andrew and Amy's presentations as we think about food security. So what I want to leave you with as we think about food insecurity and adolescents and children is to think about what families need to go through in order to meet the food needs in their household in terms of federal programs. So many of these programs are actually offered in various settings. So the Supplemental Nutrition Assistance Program that Andrew talked about addresses household need. The National School Breakfast and School Lunch programs are offered in school settings. And the Summer Food Service Program, while it's often offered in school settings through summer school, it's also provided in community settings. So families have to navigate each of these. And if there is something that occurs, such as the COVID-19 pandemic, that creates limited access in one of these programs, it's going to affect or strain other programs that families are using. So with that, I will thank you, and I'll pass it on to Amy.
All right, thank you, Andrew and Dr. Barnage. Share my screen here. All right, I'm Amy Shelton, a doctoral student here at St. Louis University, and have the privilege of building off of what Andrew and Dr. Barnage shared and explaining a little bit more about one particular school meal program that is available to high poverty schools and allows them to serve free breakfast and lunch to all students. We'll spend the second half of the presentation looking at research that's been done on whether schools participating in this program has any impact on achievement as well. So I will introduce a little bit more about this community eligibility provision. We'll take a high-level view of who's participating here in Missouri, talk about food access under the program, and then build off of that to think about how this may affect achievement, and particularly the outcomes of attendance, behavior, and test scores. The CEP was introduced in 2010. It's relatively new. It was piloted for several years and then available in Missouri starting in 2014-15. The original goal was to address food insecurity in high poverty schools while also reducing paperwork for schools. So CEP schools do not send home the application for free and reduced price school meals to all families. Instead, they're able to look at enrollment data in SNAP or TANF, Temporary Assistance for Needy Families. Any students in a school who are also enrolled in one of those programs are noted as being automatically eligible then for free meals under the National School Lunch Program. If a school has a share of students who are identified as in high need of meals, if that identified student percentage is 40% or higher, the school or district can opt to then provide free meals to all students. You can opt into the program as an individual school or as an entire district if the ISP is 40% or above on average at each school in the district, or as a subgroup of district schools that want to join together and adopt the program. Now, meals are not reimbursed 100% necessarily. So the families are not paying for meals, but schools will have to cover the difference between the ISP and a multiplier of 1.6. This is to take into consideration that the ISP reflects those who would be eligible for free meals, that there is an additional group of students who would be eligible for reduced price meals. And then anything above and beyond that, schools will pay for. The participation rate increases as that ISP increases. You'll see in yellow, only about a third of Missouri eligible schools participated if they were right at that 40% eligibility minimum, whereas when you get close to 62.5%, which is when 100% of meals will be reimbursed, then you have a much higher participation rate. Each year that we've been participating in the CEP, we've seen an increase in the number of schools. Last year, there were approximately 700 eligible schools, so we had a participation rate of 61%. This is lower than the 69% nationwide participation rate. On the right, you'll see all of the districts in the state that have at least one school that's adopted the community eligibility provision. Dark blue districts are participating as a full district with a high concentration of those districts in the Boot Heel region in the southeast part of the state. And then light blue are districts that are participating partially. So this may be one school or up to 71 schools in the case of St. Louis Public Schools. Here in our region, we have several full CEP districts: Ferguson Florissant, Hancock Place, Jennings, Normandy, Riverview Gardens, and University City are full community eligibility provision districts. Hazelwood, Rittenora, and SLPS all participate partially or almost fully. Arcadia Valley is just one example of a district that just adopted the program for this current school year. Typically, schools or districts have to decide by June 30th whether they want to opt in. This year, the USDA allowed them to consider SNAP enrollment data from the summer, which was important because there was a spike in enrollment in March after the pandemic shutdown, but then a peak in enrollment in July for SNAP statewide. And so schools and districts were able to take July enrollment data into consideration when deciding whether it was financially feasible to opt into the program. And Arcadia Valley is just one example of a district that chose to do so. We don't have the numbers yet of who all jumped into the program this year, but I'm interested to see when those come out if we had a big increase in enrollment or participation. Now, about 80% of students in Missouri CEP schools would already be eligible for free or reduced price meals. And so the question is raised whether the program is addressing food insecurity for students who need it most. It does address this issue for two groups of students in particular. There is a substantial portion of students who are income eligible to be part of the National School Lunch Program or School Breakfast Program, but who are not participating due to lack of information, application processing errors, bureaucratic hurdles, and then the stigma that Dr. Barnage mentioned, a perceived or actual stigma associated with receiving free and reduced price meals. In addition, there are students who are living in food insecure households, even though they may not on paper look like they're financially eligible. Perhaps they have expensive medical bills, for example, and so there's still a limited budget for food in the household. Ruffini's nationwide study found that once schools adopted the community eligibility provision, breakfast participation increased on average 38%, and lunch participation on average increased 12%. Dr. Barnage and Andrew both got at this, but we want to talk specifically about how might participating in a program like this affect achievement. That's not the goal of the program. The purpose is to address food insecurity. However, if students do have access to better nutrition, it's conceivable we would see an effect on attendance, behavior, and test scores, considering that the effects of poor nutrition are things such as lower engagement in school, depression, risky behaviors. In addition, if low-income families are not paying for school meals, they have additional resources then to be able to possibly support their children in other ways or support their education in other ways. In addition, if all students in a school are receiving free meals, then income is perhaps less salient in the school, and thus may improve the school climate. It removes that stigma component. And then finally, if there are, say, 3 students in a class who are food insecure and they're having difficulty focusing and perhaps acting in ways that are disrupting the class environment, addressing their nutritional needs also may have a spillover effect for other students in the class who are not food insecure and did not directly benefit from the program. So we could potentially see an impact on test scores across the school. 7 key studies have looked at this question of, does adopting the CEP impact achievement-related outcomes? Again, the program is relatively new, so this is very current research and studies are still in process and continuing at this time. 3 of these studies are peer-reviewed papers that have been published, 2 are working papers. Coe's work is a doctoral dissertation, and Gruber is a master's thesis that was looking at effects in the pilot schools early on. 4 of these studies looked at a single state, and 1 study, as I mentioned, Gruber's work looked at several pilot states, and then the 2 studies with Krista Ruffini looked at all CEP schools and districts nationwide. Just to orient you to the chart here on the left, I have the outcomes that they were attempting to measure. Behavior was looked at in terms of suspensions, and we have attendance and math and reading scores. Across the top, you'll see that a lot of researchers report out their findings by grade level bands, elementary, middle school, and high school, with a few studies that pooled all grades together and reported overall findings in the far right column. The plus signs indicate there was a positive effect related to adopting the community eligibility provision. In terms of suspensions, that means there was a reduction in suspensions. And then parentheses indicate that there's some qualification to this finding, that perhaps it only applied to a subgroup of students. In the case of 1 of those, it was just a specific model that was used in their analysis found an effect for that group. And then wherever you see a 0, it is saying there's a null effect, that there's not any noticeable difference between CEP schools and non-CEP schools in this area. I put behavior at the top because this is the area that seemed to have the most compelling findings. All 3 studies that asked about suspensions as an outcome measure found some effect. Coe reports an overall effect on reducing suspensions. The effect increased in the 2nd year of being in the CEP and further increased in year 3. It was greatest for high school students. Fuller and Comparator found effects for both middle school and high schoolers. The elementary school effect is less clear. Gordon and Ruffini note that this was just for white male elementary school students that found a reduction in suspensions, and this was higher in higher poverty schools. When we look at attendance, there was a stronger indication of an impact on elementary school attendance, with some indication that it may affect middle school attendance. However, both studies looking at high school did not report any effect on high school attendance. And then whether there's a relationship between the CEP and achievement on standardized tests is a little bit less clear, particularly in reading. We do not see clear evidence of an effect. There may be an effect on elementary school math scores. Gordania reports an effect there. Fuller and Comparator report an effect in their student fixed effects model. I'll take a minute on Ruffini's finding. So hers are put in parentheses as a qualification. She reports that there was an overall effect in math and a higher effect in elementary school, but only for districts that saw a greater increase in meal participation under the CEP. So these were districts with a lower ISP. So maybe they were just above that 40% cutoff or the 50% level. When they opted into the program, there was a greater number of students then that had access to school meals, perhaps for the first time, and that's where she found an effect. Now, again, these are preliminary studies in the sense that the research is new. We look forward to seeing what comes out in the future, whether this is further substantiated. But it's also important to keep in mind this is not the purpose of the community eligibility provision, just perhaps an additional benefit for schools and districts that are considering adopting the program. The program can be considered a success if it addresses food insecurity and reduces that paperwork burden for schools as intended. If you'd like to learn more about that research and those studies, we have a full evidence primer on our website under education reports. And with that, I'll turn it back over to Gary.
Thanks, Amy. I think Emily will moderate questions. And I know I had a couple questions, but I think we should start with the folks in the webinar room. And so one question came from Dan. He wants to know, is there any data available on the efficacy or scale of programs put in place during the spring to allow families to pick up boxes of food? I can't imagine those data would be available yet, but I'd be interested in if anyone on the panel has any ideas on that.
As far as the meal data from DESE goes, that data, like you said, Dr. Ritter, is not available yet. It's on a bit of a lag. We might imagine that less meals were handed out starting in April, but like I said, that we don't know how many meals have been handed out just yet in the months of school shutdown.
That makes sense.
I would
to
also
me.
add that there's probably a difference depending on the delivery method. So there's been community-based organizations as well as schools that have been helping to get meals out. And I think that there will be some data coming out about most effective models, but I haven't seen anything yet either.
Emily, are there other questions in the Q&A?
Yes, we have one from Brittany Whitley. Brittany, if it's okay, I can just allow you to say your question. We'll see if we can make the technology work. All right, you should have access to be able to talk now.
Awesome. Can you hear me?
Yes.
Great. Thank you. This was a fantastic first webinar, and I'm really excited for the future webinars that are coming up. One of the questions that I had, and I think several of you kind of touched on this briefly, was just looking at the uptake of these programs. So in Andrew's talk, he mentioned that around 40% of eligible families didn't receive any benefits. And so I was really wondering about some of the specific barriers that families are facing in accessing this assistance, and if there's any research about disproportionate impacts on specific populations of Missourians. Are some Missourians more or less able to access these resources than others?
So Brittany, can I confirm that you were talking, and maybe Andrew, about SNAP benefits and 40% of families who are eligible aren't using SNAP benefits?
Yes.
Yeah. So I can, Andrew, I'm sure has more to share. I can add a little bit in terms of what we know from pediatric well child visits. Especially right now, one of the things that's happening is that families complete an application, and there's such a demand for SNAP right now that they're either not connecting with anybody in the SNAP offices, they complete an application and they're not hearing back for a while. And I think that's mainly in this current situation that there's such high demand. And families get frustrated and then they look for other sources of food. So I know that that's one thing that might be context specific. The other thing is sometimes the application process can take a while, and it takes time for families to complete and follow up on those things. So they might decide that depending on how much SNAP benefits they might actually qualify for, it's not worth the effort for those dollars.
There's also been, and I'm not an expert on the systems that Missouri has available, but there's been some reporting that the systems just aren't very up to date, and it's been difficult for Missouri to contact families in general. While it's not necessarily good news, I think it's also important to say that Missouri actually, from what I understand, is not that much different from many other states. Illinois has a fairly similar rate to families that are eligible that are going without benefits, as does the nation. That's not good news, but this isn't just a Missouri problem, it seems.
Thanks so much, Brittany. I think our next question is from Evan Reinsmith, who's the Director of Research and Evaluation at the PRiME Center. And Amy, he would like to know from you about if you can speak more about the methods that you use, or that the articles use, sorry, that you've included in your analysis, and whether these articles are reporting causal relationships.
Okay, thank you. Yes, great question. They are looking at causal relationships. So it's important to note whenever in education or any field, if we're trying to find cause and effect, that we have to report those relationships tentatively, because there are, of course, other things that are impacting attendance or behavior test scores. These studies all use what would be considered best practices in the field in their attempt to get at whether there is a direct causal relationship there between the CEP and these outcomes. So for those who are familiar with the literature, 6 of those studies use difference in difference, and 1 uses a comparative interrupted time series design. In brief, at the risk of oversimplifying it, they're looking at comparing schools that were eligible and did not participate with schools that were eligible and did participate, and matching those schools essentially through their models in terms of the overall poverty level at the school, the race of the students, sometimes the special education status of students, how many English language learners. So looking at some schools that were similar and those that chose to opt in compared with those that didn't, looking at the kind of trajectory of what was the track that test scores were on already. Perhaps test scores were already increasing, but then we might see at the time of participating in the CEP that test scores increased to a greater extent for those schools that were in the program than it increased in the other schools. And so they're looking at schools that are similar as much as possible in every way, and did test scores increase more for those who were in the CEP, then we would say that there's some effect due to the community eligibility provision.
Great, thanks so much. Our next question is from Dr. Ibrahim. May I ask if she wants to speak? Habiba, would you like to state your question?
Sure. Thank you all to our panelists for this great presentation. This question is more related to the work of Dr. Barnage in public health. There are some neighborhoods, particularly low-resourced neighborhoods, who are mostly food deserts. And while we have seen the work that you've spoken of, the challenges of the cost and availability, is there any research that connects the food desert neighborhoods and the resources available, and how that impacts the health or other outcomes for children who grow up in those food desert neighborhoods?
That's a great question. Yes, there is a pretty large body of literature that looks at low income, low access, low food access neighborhoods, and how availability of food in communities affects the health. I would have to look more closely at articles that connect it specifically to child health. But there has been demonstrated in the literature that our food environments do impact our health, particularly as it relates to obesity and BMI, and consumption behaviors to some extent. So consumption of fruits and vegetables specifically. But yes, there is a large body of literature There are food atlases that have been developed by the USDA to actually allow you to identify if your area or your school district is a low income, low access area as well. So there's tools as well as a body of research.
Dr. Barnage, I wonder if I can follow up. This is Gary Ritter, and I've been involved in a couple stalled efforts to try and put together a randomized controlled trial where we would, have healthy food delivered at a few elementary schools and do the status quo at a few others, just to get a sense of what could really happen if the school lunches, we have access to students and their palates 5 days a week or more, 5 times a week or more if they do breakfast at school. And certainly the team where we've been unable to get those projects up and going had a strong hunch that this would make a real positive difference for kids. So I wonder if you could talk about, have studies like this been done? Have they been really solid, experimental design studies? How confident are we as a field that this could make a really large difference for kids? And at the risk of making a long question longer, does it have to cost a lot more? Or could we do it in a way that is indeed almost roughly similarly costly to the mostly lousy food we feed kids now with school lunches?
That's such a wonderful question. And to be honest, I typically tend to focus on the environments outside the school setting. So I don't know the literature around interventions that sort of go above and beyond school meals. So school meals as they're currently delivered. So if you're delivering food boxes with fruits and vegetables, for example, there's a lot of studies that are also done around community gardening in schools. The thing about behavior related to nutrition is that it's complicated. It's not only about getting food to kids, but then it's also about changing the norms about what we eat, so that there's then not only an access piece, but also eating behaviors and how we integrate potentially new eating behaviors into children's lives and into their household norms around what they eat as well. So I am not sure what the data says, but I do know that eating behavior is complicated, and it is not just about access, but I think that certainly school meals is a place where we can begin, because it's something, it's an access point for many families and many kids. So there's definitely opportunity there. One thing that needs to be considered as well as the contracts with food service providers. And as you said, how can we create interventions that are actually economically feasible?
Thanks. One of the prompts for these discussions were folks in nutrition who believed strongly that you could create food that was indeed nutritious and not that much more costly. And indeed, they were zealots for it. They believed you could make it interesting and tasty enough where kids would actually eat it, because as you said, their habits matter. And now it wouldn't necessarily change what happens at home or the other meals that happen during the week. But I guess that's what made it such an interesting empirical question. How much could we leverage just the meals that we actually delivered through schools to make a positive difference? Thanks for your response to that.
I will add, Gary, that folks in nutrition and dietetics, some of the faculty have since left, but they did have an intervention with Maplewood Richmond Heights called HELP, so Healthy Eating with Local Produce, where they were really integrating healthier options in the lunch menu in particular. So it would be good maybe to follow up with them to see what their outcomes were.
Thanks again.
Great. Dean Ritter, any other questions from you? I think we've exhausted the ones submitted from the panel. Nope.
No, I'm great. I went well over my time limit with my earlier question.
Great. 1 second. Let me share our final slide here. So thank you all for joining this webinar. We really appreciate you coming today and asking some great questions. If you have questions, feel free to follow up with us. Our email address is prime@slu.edu. I think we're all pretty easy to find too if you want to email any of us individually. Do visit our website at sluprime.org. You can sign up for our weekly newsletter there that comes out on Fridays, I believe. And as Dean Ritter said at the beginning, please do follow us on Twitter. We try to share updates on interesting research and topic as it comes out, and would love to have you as part of our network. We will be starting a monthly webinar series, and our next one is on discipline disparities in Missouri at the end of January, so on January 27th. We haven't opened registration yet, so you'll have to follow us if you want to join that webinar. Thank you so much to the panelists today, too. This was our first webinar, so I appreciate everyone being the guinea pigs for figuring this out. If anyone has advice for us about how to make these even more useful, please let us know. Thanks so much. Enjoy your day.